pulses. She has 2+ pulses bilaterally. And I've already checked her hands and her arms, and I'm going to have you try to push against my hand with your wrist and the opposite. And so she has 5 out of 5 wrist strength as well bilaterally. Alright, so I'm not going to do a breast exam, but I'm going to explain today what I would do if I was to do a breast exam on a patient. There is a little bit of a difference between a male and a female. For the female, if they're in a sitting position, what I would do is support their elbow and kind of go like this as I'm checking the axillary area for lymph nodes. And make sure there's no masses or lumps in there and no tenderness. Then for a male, you want to do this in a sitting position with their hands at their side, but with the female, a lying position is best in the arm above their head, such as this. You're going to go in a circular motion, so if this is the areola, you're going to go around it with deep palpation, enough so that you can feel the underlying tissue in the breast. And you're just going to make sure that there is no masses or lumps in there and no tenderness. And so then you're just going to keep going out around it in a circular motion. You're also going to check, like I said, the axillary area, because you want to make sure there's no lumps or masses in there. And there should not be any tenderness, masses, or lumps. Then you're going to gently palpate the nipple and squeeze it just a little bit to make sure that there is no discharge coming out of the nipple. And you should do this monthly. You should check monthly. You can do it while you're in the shower or before you get dressed, whatever, but you should do it with naked breasts. Do not wear a bra, and just, like I said, circular motion. There is other ways to do it, but I just find the circular motion better because then you don't forget which direction you've gone. Alright, so moving on past that, do you have any questions about that at all?
No.
Do you do monthly checks?
I try.
Okay. Alright. Alright, so moving on, we are going to check your abdomen. So I'm just going to have you lay down there. Alright, so is it okay if I raise your shirt just a little bit so I can check your abdomen?
Yes.
Alright. And I'm just going to undo the top button of your pants so that I can see here. Okay, so you do have a scar on your belly, and is that from
the hysterectomy?
The hysterectomy? Okay. So the patient is noted to have a flat abdomen, but it is symmetrical bilaterally. The skin is pink, dry, and warm. And there are no lumps, bruises, or lesions noted. There is a slight pulsation here in the middle of the abdomen, which is most likely the aorta. And then I'm just going to auscultate for bowel sounds in all 4 quadrants. I'm going to start with the diaphragm, and we're going to listen until we hear a bowel sound. Starting in the right lower quadrant and moving around until you get to the left lower quadrant. Alright, bowel sounds are present in all 4 quadrants. Now I'm going to auscultate with the bell right over the aorta, just to listen for breweries. No breweries are noted. So I'm going to do light palpation on this patient, just to check for any tenderness, masses, lumps. Any tenderness at all?
No.
Okay. And then I'm just going to percuss over the areas as well. Alright, so there's tympany heard throughout. Sometimes over the bladder you get dullness, but she also had tympany over the bladder. I'm going to try to percuss the spleen sometimes this is difficult to percuss, and I wasn't able to hear a difference in the sound, but the spleen is right over here in the left upper quadrant. So again, tympani was heard throughout all quadrants. All right, so I'm just going to close your pants up here, and then I'm going to check your lower extremities, okay? Any pain or tenderness in your legs at all?
No.
Okay. Nothing in the knees?
No.
Okay. Patient does have some varicose veins bilaterally. There is symmetry. The skin is pink, dry, warm to the touch, but not hot. She has had DVT in the past in the right lower leg, but there's no redness or swelling in the legs at all. Hair distribution, it appears that she just shaved her legs, so there is no hair noted to the legs. And I'm just going to check your hips here. Hips are symmetrical, and they are stable. I'm just going to have you raise your leg and down, and then out to the side, and the same for the other leg. Up, out, and in. Okay, so patient has full range of motion in the hips bilaterally. I'm going to have you bend your knee as far back as you can, and then out, and same with this one. So full range of motion is noted in the knees as well, bilaterally, and there's no edema or tenderness, as she said before, bilaterally. No deformities either. The ankle does have a little scar here on the side, which she said that she did have some surgery and she has placing screws in this left ankle. Other than that, there's no deformity. She has full range of motion bilaterally in the ankle as well. There's 5 digits on each toe. The capillary refill is less than 2 seconds, and there's no deformities noted in the toes either, bilaterally. Okay, so try to raise your push towards my hand. Push on the gas. And then try to raise your leg. Okay. So patient has 5 out of 5 muscle strength in ankles, feet, and legs. And then I'm just going to test the Hohmann sign. All right, so I'm going to slightly bend your knee, and I'm going to push forward. Let me know if there's pain.
No. No.
No pain? All right. Okay, so the Hohmann sign is negative. So I am going to do some light touch on you. So I'm going to have you close your eyes and just tell me where you feel the touching.
Forehead, chin, right upper arm, left upper arm, left hand, right thigh, left thigh, right shin, left shin, right foot, left foot.
Okay, and now keep your eyes closed, and you're gonna feel a little bit of sharpness. It'll feel like this. Do you feel that?
Yes.
Okay, where do you feel it?
Left hand, right hand, right arm, left arm, forehead, chin, right leg, left leg, right thigh, left thigh, left foot, right foot.
Okay. Now I'm going to have you keep your eyes closed and just tell me what position your hand is in.
Up, down, up, down, up, down, up, down.
Okay, perfect. So her kinesthesia is intact. Now I'm going to check your her stereognosis, and so I'm going to have you keep your eyes closed. I'm going to put an object in your hand, and I want you to tell me what it is.
A key.
Okay. And then your other hand here.
A paper clip.
Great. Okay. Alright, so keep your eyes closed. I'm going to write a number on your palm, and you can tell me, or try to tell me what it is.
A 1. A 2. A 3. A 4.
Perfect. So her graphesthesia is intact as well. Okay, so I am going to check your reflexes now. So I'm checking her biceps, triceps, brachial radialis, and up here. Okay, so those are 2+. I'm going to check your Babinski. We had flexion in the feet bilaterally with that. Alright, so I'm going to flex your foot. Ankle clonus is negative. There is no movement with the flexion bilaterally. I'm just going to check your abdominal reflexes here. Okay, the superficial reflexes were not noted. That's not always uncommon with the abdomen. So, okay, I'm going to have you sit up here on the side of the bed so that I can check your knee and ankle reflexes. Okay, reflexes are 2+ in the ankle, or excuse me, in the Achilles and the patellar bilaterally. Alright, so I'm going to have you stand up. Going to get to do some exercises here. So the client is erect, body is symmetrical, the spine is curved at the bottom, which indicates scoliosis, but there is no deformities other than that noted. She is a small frame. The muscle size is symmetrical bilaterally, and has been no tenderness or deformities noted in the bones or in the joints. And as I said, the temperature was normal, warm, and there was no edema to the joints bilaterally. Now, if I can just have you bend over and touch your toes, I'm just going to check your spine. And again, as you can see, the spine does curve to the right just a slight bit at the bottom here. All right? Any pain or tenderness when you did that?
No.
Okay. Stand on one leg. Okay, and then the opposite leg.
That's my bad ankle.
Oh, okay. And then, so we probably shouldn't have you hop on it then, should we?
It really doesn't hurt. It's the balance.
Weak.
Yeah.
Yeah. Okay, well, I'll have you hop on this ankle. I'm not going to have you do it on your other ankle. Okay, and then can you do heel to toe, like this? Perfect. All right. And then just stand with your feet together, arms at your side, and close your eyes. All right. Well, everything checks out today. I am glad I've got to spend my afternoon with you. Do you have any questions at all for me?
No.
Okay. Well, I will send the lab tech in to get your blood so we can test your thyroid, just to make sure your medicine's doing what it's supposed to do. Okay? And if you have no other questions, I think we're finished.
Thank you.
All right. Thank you. Have a good day.